The pandemic has done a few things to us. Many of us lost families, loved ones. Many of us lost jobs. Many of us moved. I moved to Italy. Many of us lost career pathways. We changed career, opened our eyes to purposes, good and bad. The pandemic, the COVID-19 pandemic, did not just come and go like that. It's still with us. The residual effects of this pandemic still stay with many of us. Some scholars believe it's going to take years before we begin to realize what really happened to us from 2020 onward, or even before then, for other people in Asia countries. But yes, let's talk about something that we don't often talk about from the pandemic. Most of us know about policies, we know about government policies, we know that governments make decisions about a few things that happened during the pandemic. Most of us know about the issue of inequity in science. We know about the science, the different views about science of the pandemic. But what most of us don't know is some kind of people that are in the Situation Room. These are the people that the mayor of this world, the governors, the presidents, these are the people that these governments, they task, they tell these people what to say, how to talk to us, those of us on the outside, about the science of the pandemic. And these, I call them the storytellers. These are people that you don't often see papers written about. If you go to your scholars, to Google Scholars, and you research how many papers have been written about COVID or about science, about public health, you're going to see a lot of stuff because we're living in a world that is obsessed with measurement, where we want to, the positivists, we want to measure everything. We want to see all the data correlating, how many people actually wore a mask, how many people got vaccinated. But behind all of these numbers, they are people who tell stories, who are able to weave images, text messages together, colors, to make magic. And these are people I call the storytellers. It's not the first time these people will be called to duty. We've seen them for the eradication of polio in part of the world today. We've seen them during the HIV/AIDS campaigns that were done. And we've seen them in companies like Nike, like Dove, creating an amazing campaign to bring the world together. One of the biggest tasks these people have is to appeal to our empathic self, is to make us, for instance, to wear a mask. You know how difficult it is for you to tell people who actually don't believe in government, people who have a medical mistrust or distrust, to tell them to believe in the science that government is saying. So we have the anti-COVID, anti-vax, we have COVID deniers. You may hate them, you may dislike them, but they have their points, they have their arguments. But the storytellers have to convince, they have to win people over. They have to make people stay at home when we were locked down at home, when there was a lockdown. So how do storytellers make their choices? How do advertisers, who I call the storytellers, people who use words, images, these are the creative people from the agencies, from the client side, who put together posters that speak to us, that speak to our emotions. How do they transport us from a place of disbelief to a place of empathy and action? How do they make us to actually think about others when we think about what to do, why we should not go to a party, why we should stay at home? So these are things I'm interested in. In this podcast, I will be examining choices made by storytellers like myself. How these people make these choices. Like a fly on the wall, I'm going to be examining some of these choices. I'm going to be looking at some of the campaigns that have been created during this pandemic, in the pandemics before, and in other situations. I'm also going to go into the commercial spaces. How do commercial brands create inclusion? How do they make us to step outside of our comfort zone, to embrace the uncomfortable, to love, to address issue of racism, to address issue that make us uncomfortable when we talk about life? Because listen, branding, advertising can be seen as capitalistic, But it has also brought the world a lot of good. It has made the world heal. It has made the world to be a place where we have fun. It has made the world, if you argue, a better place, as much as it has made a lot of money while doing it. I'm interested in the intersectionalities of all of these complexities. How did we get here? And how do we make these choices that we make as storytellers? My name is Kende Badamasi. Welcome to my podcast.